I'm showing a case, 31-year-old male with history of left facial droop. It is a pretty subtle finding, but anyway, this is the acute stroke. This is all right. That I later proved that is a stroke. But the problem is was interpreted of this lesion as an arachnoid cyst. Arachnoid cyst has a differential diagnosis with porencephalic cyst. Porencephalic cyst basically is surrounded by scar tissue of the brain from prior injuries such as trauma, not compressing on the cortex, versus the arachnoid cyst will compress on the cortex. This one shows the lateral ventricle getting more prominent adjacent to the cyst, so suggesting this is a cavity resulting from loss of brain parenchyma instead of having a bag of water compressing on the temporal horn. On the MRI, you can easily tell that the brain parenchyma adjacent to it shows some gliosis, the white T2 hyperintensity, not like the other side. And also you can see that the temporal horn is much more larger as compared to the normal left side. CT is slightly more difficult to tell, but this is clearly shown this is not a arachnoid cyst. As shown in literature, the differential diagnosis of this arachnoid cyst can be epidermoid, chronic subdural hematoma, hygroma, or other cysts such as porencephalic cysts. The normal arachnoid cyst does not have the white T2 lining against the cyst, and also the cortex are preserved. The cortex are being pushed but preserved. Our case show the cortex is gone. It's gone. Show some scar tissue. This is point number one. The next point, which I'm showing, this is a study that was done about a year later. It's another CT with a similar symptom. Actually, the history is saying a patient had previous stroke with similar symptom, dizziness and emesis. This is the previous one, 2014. This is 2015. So the previous subtle stroke become more obvious. Basically, when the brain had ischemia, the body repaired it, and then resulting in a hole. It's called encephalomalacia, a hole containing water. This is how this brain healed lesions with a scar around it. This porencephalic cyst didn't change. However, the symptom is dizziness and then reportedly similar symptom. There is a subtle finding that's very difficult to find. On this side of the superior cerebellum is hypodense as compared to the other side versus normally symmetrical on either side in the previous CT study. In the next day, the stroke is much more prominent. So early stroke is difficult to identify. A late stroke is easier to identify, however, it's too late for any intervention. This one is so stroked out that causing edema and swelling and compressing on the fourth ventricle. At the time was not that bad, about a day earlier. Therefore, importance of history, so we can scrutinize the area of anatomy carefully, is very helpful to detect subtle lesions. For this one, I don't see any clot, even though it's clearly superior cerebellar artery territory distribution. Here was a history and original report.